Morning and welcome to the chat on Newsday Amarillo and News Channel 10-2. I'm David Lovejoy.
Good morning, I'm Rhonda.
And I'm the Sultan of Satire, Chuck Williams, Chuckalicious.
Joining us right now is Dr. Haley Owen with Livingston Hearing Aid Center. This is a special week. It is Tinnitus Awareness Week. She's here to tell us a little bit about this and check on your hearing. Go right ahead, Chuck.
Doc, let me ask you this. Just tell me, what is tinnitus and what is the Awareness Week all about?
So tinnitus is basically any kind of ringing or noise in your ears. And the purpose of this week is to help educate people about tinnitus so they can learn its effects and really what to look out for. Tinnitus is an underlying condition of hearing loss where people hear, and people describe this in many different ways. It could be ringing or buzzing or whooshing, but really any kind of noise in your ears. Could be caused by hearing loss, could be caused by ear damage. There's other lifestyle factors in there as well, but it's not a new condition. And this week is really about dedicated to raising awareness and encouraging people to take a step back, to take care of their tinnitus if they're suffering from that.
So this is not necessarily an age-related problem. This could happen to anybody. Who is most affected, do you think?
Mostly it's mostly going to be the adult population. So, 10 to 15% of the population suffers from ringing in their ears. 90% of those people also have some degree of hearing loss. Now, while there's no cure for it, there's been a lot of advancements in technology, specifically in the hearing aid world. And we really are much more equipped to help with the ringing these days than we were.
What's the treatment course for tinnitus? Is there devices or the medication? Does it depend on the severity of it or where they're at? What's the course to help people with this?
The most common treatment actually is amplification or hearing aids, right? So by raising the sounds in the environment, or basically making you more able to hear those things, we're able to mask that sound. Many times we can reduce, sometimes completely eliminate the ringing while you're wearing the device. Now, that doesn't always work. When that doesn't work, there are maskers that are built into hearing aids. Now, these basically help to cover that ringing sound to make it less noticeable. There's other options. There's sound therapy and tinnitus retraining. These are a little bit more intensive. The easiest method actually is amplification, just treating the hearing loss.
If that's the case, if I suspect I have tinnitus, what do I do? Help me, please.
Well, the first step is getting you in to have your hearing tested. Right. Once we determine where, and this is a hearing loss that a lot of times people aren't even going to notice. It's not a hearing problem per se, right? These people are going to say, I hear fine. But you could have a hearing loss just in the very, very high frequencies. It doesn't necessarily have to affect your ability to communicate, right? The hearing loss is still there. And by treating that hearing loss, even if it's just a high frequency loss, many, many times we can, overcome the ringing. But we got to start with getting a hearing test.
So I've noticed, I have family members that don't hear very well. And it seems to me that they lose out on a lot of life. Like there's things going on around, conversations, things like that they are not able to be a part of. How important is it to get this checked out and maybe get some hearing aids?
I mean, we recommend testing your hearing annually. There are so many other health effects that are involved with hearing loss. Recently, I'm sure you've seen in the news cognitive decline, increased risk for dementia.
Right.
There's also increased risk for heart disease. But about what you're speaking to, loneliness, isolation, depression, people withdrawal. When we can't hear, it's hard. It's a lot of work to listen when you can't hear all of the speech cues, right? So. And we saw this a lot with the pandemic with masks. People were withdrawing, pulling away. Communication is just more difficult. So getting your hearing tested at Livingston, we recommend every year. To get that tested. If it's normal, good. We don't need hearing aids yet. But the sooner we can treat it, the better off you're going to be in the long run. Waiting to treat the hearing loss usually isn't the best answer.
I have a follow-up question.
Go ahead.
So when you're speaking to someone and it's like they get the last few syllables that you say,
Right.
but they miss the first. Is that something that can be corrected with hearing aids?
Yeah, most people, the beginning stages of hearing loss usually are, like I said, in the high frequencies. When we don't hear the high frequencies, again, it's not a volume thing. I hear fine. What they miss out on are usually the beginnings and the endings of the words, the consonant sounds.
Right.
It's the clarity that gets affected. So usually when they say what, it's not that they can't hear you. They just can't always understand the words. And if
Right.
we can amplify just in those high frequency areas, then we can bring the clarity back without necessarily having to turn the volume up.
Just recently, they changed the rules, trying to change the laws about where you can purchase hearing aids and how you do that. And sometimes people don't understand there's a difference between a hearing aid and an
Mm-hmm.
amplification device. Why is it so important that you go and get checked out and not try to self-diagnose yourself and then go to the drugstore and buy these amplifiers?
Yeah, I mean, and there's it's not to say that the ones over the counter
Right,
are
right.
bad, but getting your hearing tested will help us help you determine whether something like that is appropriate. Those types of devices are really designed for mild to moderate hearing loss, and if we're beyond that point, then we're not getting enough help from a device like that. Um, one of the best things about the over the counter devices though is they've made it hearing health or hearing aids more accessible, more affordable. You know, so for someone who may have decided to put off treatment because of the cost of hearing aids, you know, we now have these options, these over-the-counter options for those people that are in that mild to moderate range. We're you know, hopefully they can treat it sooner, you know, with a lower price tag, right? At a certain point, though, when the hearing loss gets to be too severe, we really do need more advanced technology, you know, just better programming ability with these devices. So they both have their uses, right? They're both appropriate for certain types of hearing loss, but without getting your hearing checked, it's difficult to determine which is the right answer for you.
You can go and give the folks at Livingston Hearing Aid Center a call. That number is 806-553-6695. They're located at 1600 Coulter. Dr. Owen, thank you so much for this great information. We appreciate
Absolutely. It's always good to be here.
it. Good to see you. We're going to take a break. We're back with more chat right after this.